Greetings and welcome to All the Facts. My name is Dr. TJ Mohale. Today is Thursday, the 30th of April, 2020. Is just gone past 22 hours Central African time. The message here is simple. The message is the message from the president, and the message is that you must cover your face with a cloth mask. If you do not have a cloth mask, you should make one, or you can just use a bandana like myself. Of course, I don't go to work with a bandana. I try and get a mask from work. So please cover your face so that when you cough, your saliva does not spit all over the place, fall onto surfaces. Even if you are alone, please do not cough all over the place. Your droplets fall onto surfaces that people can potentially touch and touch their face. That's why it's important not to touch your face and to disinfect your hands regularly. So, now that we've got that out of the way, let's start with a little correction. It's been a few days, over a week, since we have done all the facts. The reason for that is because my network provider has been destroying me, and it's been raining. I like rain. So it's been raining, but unfortunately when it rains in this village with very poor network connectivity, we lose network, and that is one of the reasons why we haven't been able to do this. Anyway, we are here today. So I wanted to start with a correction. In the last video that we did, when we were talking about staff levels and public wage bill, I said that the death toll globally for the Covid-19 virus is approaching 100,000. The correction there is that I meant on that day when we did that video, the death toll internationally around the world was actually closing in on 150,000, I mean. Since then, in the last few seconds, I checked, we will be back with the laptop tomorrow when we continue other topics. So the statistics globally reads as follows. Confirmed cases, 3,255,454. So globally, the cases are closing in on 3.3 million. That's a lot of people. So those are confirmed cases, PCR. Laboratory confirmed cases. These are people who have been tested and we are sure they have the coronavirus. This is obviously a lower number than in reality. In reality, all evidence point to the fact that the infection is much more widespread than this. The number of deaths globally in the past few seconds, when I checked on the Johns Hopkins website, which tracks the virus globally, it's reading 231,415. 231,415 people have succumbed to the SARS-CoV-2 virus, which caused the disease COVID-19 and COVID-19. The USA is leading the charts with cases confirmed to be standing at 1,056,402. So the US crossed the 1 million mark, I think yesterday or the day before. The deaths in the United States are sitting at 61,717. So that's a very big number. So we can safely say very soon the United States is approaching 100,000. The initial projections from Harvard, Washington, D.C. University were saying that America might see death toll between 100 and 200,000. God forbid, but it looks like things are going in that direction. And remember, states have started reopening in America. Places like Las Vegas has started opening strip clubs there and bars. So we don't know how that will affect the virus and the spread in the United States of America. But many states are pushing for reopening. Welcome back home, South Africa. We are sitting at 5,350 cases and 103 deaths. Let's just touch on testing in South Africa a bit. We did a few mathematics in the past videos when we were talking about testing, and we agreed that the most important number to look at on testing is the average. It does not really help much to say today we tested this X number of, we conducted this X number of tests. In the month of March, South Africa conducted, on the 31st of March, the total number of tests conducted were 41,072. Considering that we started testing around the 2 or the 3rd or the 4th of March, we can safely say that there's already Matumi Kapa is asking, President Donald Trump at POTUS 45 is saying the numbers in the USA are due to their intense testing efforts. I will come back to your question. Let me finish this point I'm trying to make. I'll answer your question just now. Very good question. Thank you. And remember, keep posting questions. Engage us. So we can safely say over a period of 26 days in March, South Africa tested 41,072 tests at an average of 1,579 tests per day. Average. So we look at the whole month and we do a basic mathematics. So in March, we conducted on average 1,579,000 tests. I am proud today to say that things have improved. In the month of April, today is the end of April, we have conducted 207,530 tests. We can clap hands for that. That means over the past 30 days, on average, the Republic of South Africa, Department of Health, under the leadership of His Excellency the Honorable Dr. Zweli Mkhize, has conducted on average 5,441 tests. South Africa has conducted in the past 30 days, in the month of April, on average 5,441 tests. The good thing at the moment is that we are seeing reports from the NICD that says that over the past 24 hours, we have conducted more than 10,000 tests. So we can happily say South Africa is now at a capacity of conducting 10,000 COVID-19 tests a day. This is the highest test we have done on any given day. The average is still saying 5,441 for April, looking at the whole month. This is good, but is it good enough? This speaks to your question there, question number 2, which says, does this mean so let me just read both questions. Donald Trump says the numbers in the USA are due to their intense testing efforts. Does this mean their reflection is much more realistic than ours? Well, we said for you to be able to create a graph, you need numbers. For you to have numbers, you need to test. That in England, Dr. Campbell says, Dr. John Campbell is a retired infectious disease physician there in England. He says testing is the light that illuminates the virus. So if you are testing more, you are seeing more of the virus. But as you can see in the United States, they do not only have high cases, which means they are seeing more viruses. No, they are also seeing the highest death rate in the world. The United States, as I just said, has 61,717 deaths. So we can safely say the virus in the United States is far much more widespread. You can do the death rate using the confirmed cases and see the death rate and compare for both countries. So South Africa has 5,350 cases and 103 deaths. So you can do the mathematics. You can do the mathematics there and say 103 divided by 5,350 multiplied by 100. We see a death rate in South Africa of 1.9%. We can do the same for the United States and say 717 divided by 1,056,402 multiplied by 100. We see the United States has a death rate of 5.8%. Earlier on, we were told that the expected or average death rate is around 3%, 2 to 3%. The United States is seeing the virus because they're conducting more tests, but they are also experiencing a very high death rate. You can check the numbers on the John Hopkins website and do the mathematics, basic mathematics, and see, compare the United States with other countries that we thought were the hardest hit, like Spain and Italy. A few weeks ago, Italy was on fire, but they have managed to contain things. They have passed their peak. Italy has only a population of 60 million, but they have seen around 27,000 deaths. So they are very high. So the message is that we need to test more. So hopefully in the month of March, we will be testing more. But remember, the minister's target, last month the minister told us we're testing 5,000 people a day. That is not true. In the month of March, we tested on average 1,579. On the same day that the Minister of Health said that we are testing 5,000 people, he said his target is to test 36,000 people a day. So as much as the NICD is saying South Africa has conducted 10,000 tests in the past 24 hours, 10,000 tests is still 26,000 tests behind the minister's target of testing 36,000 people. So we are still very far behind. So our testing need to improve. Our capacity need to improve. So as I have announced before, the topic for tonight is just to clarify and answer a few critical questions regarding the Cuban deployment. The Cuban deployment, or what they call the Cuban Brigade. So on Sunday around midnight, Sunday 26 April, just a few days ago, at Waterkloof Air Force Base in Pretoria, a big plane carrying around 217 Cuban medical doctors arrived at the Waterkloof Air Force Base in Pretoria to help fight the COVID-19 pandemic in South Africa. Since then, there has been many questions. You have a lot of questions, and there has been many newspaper articles around the issue. People are saying, why do we need to go to get doctors in Cuba while we have doctors in South Africa? Doctors in private have said, we have not been asked, we have not been consulted. Doctors in private are saying that they have actually cut down work in their private practices because there is no work. People are afraid to go to the GPs. The lockdown is having a very serious impact on private practitioners, medical practitioners in private. Elective procedures have been cancelled in private hospitals. So basically, private doctors in South Africa are saying we are available, and the government overlooked us and went to Cuba and got 217 doctors. Well, one of the most contested issue is the cost. Apparently, the cost is around 500 million rands. People are asking, could this money have been spent better, or could this money have been spent on something else? Healthcare professionals are saying, we don't have PPE in our hospitals, but the government has money to bring doctors from Cuba. The South African Medical Association has issued a statement and said, we were not consulted. In the same way that the South African Democratic Teachers Union, which represent teachers in South Africa, is saying, the Minister of Education is doing things without consulting us. The Minister of Cooperative Governance yesterday said that the government of South Africa is a listening government that listens to its people and their consultations. But two big unions have come out to say yes, Beauty is asking. Someone said that doctors and nurses in South Africa don't want to work in rurals. Meanwhile, we are the victims of deployments. That's a very good question. We will speak to that. We will definitely speak to that. I was still saying the ministers are saying the government is listening. Big unions are saying they have not been consulted. So it seems conflicting. We don't know who the government is listening to, but the government is saying that they are listening to the citizens. So we don't know which citizens they are listening to. We are a population of 59 million. So maybe there is a section of the population that they listen to. Nevertheless, I want to take you back to 1996. We all know Cuba. We all love Cuba. So this analysis is not about Cuba and the Cuban doctors. They are as much a victim of the circumstances that we find ourselves in as we are. So this analysis is not about Cuba. This analysis is about the Republic of South Africa and the decisions that have been taken since 1996. So why do I keep repeating 1996? So 1996 was just 2 years after the first democratic election in South Africa that saw Little Nelson Mandela rise to power on the 27th of April, which we just celebrated 3 days ago as Freedom Day in South Africa. 2 years after that election, President Nelson Mandela visited the island. He went to Havana. In Havana, he met with one president of Cuba, Fidel Castro. They signed a lot of bilateral agreements, country-to-country cooperations. One of the things Nelson Mandela asked Fidel Castro was, how do you how do you have so many doctors and how do you have so many medical schools? And Nelson Mandela clearly presented a problem to Fidel Castro and asked for help. Why did he ask for help? This one speaks to your question there, Beauty, which says South African doctors don't want to work in rural areas. So Cuba has around 28 medical schools. So they have capacity to train doctors. South Africa now has 9 medical schools. For many years we had 8. For many years we had 8. You see, so it would seem in 1996, President Nelson Mandela asked for help from President Fidel Castro about doctors. Why? Well, after apartheid and being ushered into the democratic dispensation, healthcare became a universal right for everyone in South Africa. The government was under pressure to improve access to health. One of the main campaigns and guiding principles of the ruling party in health is that health must be accessible to all, and the quality of health must be commendable across all borders, all sectors in the country. So, President Mandela was under pressure to increase the number of doctors in South African hospitals, particularly rural areas. I'm not old enough. I was born just now. I was just born in 1989, so I was born just 5 years before democracy. But those who are old enough will tell you that under apartheid, healthcare for the majority of South Africans, by the way, who are black and living in rural areas, it was not necessarily a priority for the government. Yes, there were hospitals, but I implore you, look at who built the hospitals across South Africa. Missionaries. The hospital I'm working in, where I'm coming to you live now, is called W.F. Nobel. That is the name of a person. That is the name of a white man. A white man who built this hospital in some years ago. I don't remember the date, but a lot of hospitals in South Africa were built by missionaries. Go through the Eastern Cape, missionary churches. Go there in Cape Town, you will find a hospital called Victoria Hospital. It was built by missionaries. So the apartheid government was not necessarily in the business of building schools, hospitals in the Bundus. You will have a missionary church in the Bundus that will build a school and will also bring about a hospital. The government will be involved in running the hospital and so on and so forth. But if you understand, if you have traveled the country, go there to Queenstown, you will find a hospital there called Frontier Hospital in the town of Queenstown, somewhere in the middle of the Eastern Cape. You see, so there are a lot of hospitals in the Bundus that were built by missionaries. After democracy, the government had to take over the entire hospitals of the country. They had a mandate to improve access to healthcare for everyone. Most importantly, the blacks who have been neglected by the previous government. So Mandela had to act very quickly. So Mandela asked for help from Castro. They say, if a man asks you a fish and you give him a fish, you feed him for 1 day. If you teach that man to fish, he will never be hungry. So I can tell you that my analysis is that in 1996, when Nelson Mandela signed the agreement which led to South Africa sending over the past 23 years thousands of students to study medicine in Cuba, essentially Fidel Castro gave Mandela a fish. That is why even today, 24 years later, South Africa is still sending students to Cuba to study medicine. Why? Because the government has never addressed the problem we had in 1996. And the problem is simple. We do not have the capacity to meet our need for training medical students. We as a country are not producing enough doctors for ourselves. That is why we are sending students to go and study in Cuba. It's been 26 years of democracy. We have not expanded the medical capacity of training medical students in this country. We are still sitting at more or less the same number of universities we have. With 9 medical schools, each university accepting around 250 students, our capacity is well below 1,500 students in this country, trained per year. Now, why is that not enough? Well, people retire, people die, may they rest in peace, and people leave. Okay? People leave. People have been leaving the country for the past, doctors have been leaving the country since democracy. Since every country, doctors leave and go work in another country. That's just the way it is around the world. But in South Africa, it has been very bad. Go over there to New Zealand and ask them how many doctors working in New Zealand trained in South Africa. We are training doctors for the United States, Canada, England, New Zealand, Australia. Primarily, those 5 countries. It's called brain drain. Brain drain is when a rich country takes the best skills from a poorer country. England has more universities than South Africa can ever imagine of having. But England doesn't have a problem employing doctors from South Africa. England doesn't have a problem employing doctors from Ghana. Go there to England and ask them how many of the doctors working in their national health system trained in African countries, Nigeria, Ghana, Africa, South Africa, Zambia. So we have these circus, ongoing circus, whereby each country, you see, is taking doctors from other countries. It's been ongoing. The government has always known about that problem. Many African countries do not have medical schools. So South Africa should be a shining light in training for those countries. For example, we have an agreement with all our SADC countries. Every university knows they have to take X numbers of students from Botswana, X from Namibia, X from Zimbabwe, Lesotho. You know, we have a moral obligation to assist our neighboring countries. You see, South Africa has an agreement that they do not hire doctors from Botswana. Doctors from Botswana train in South Africa and they must go back and work in Botswana. You see, so that the healthcare system in Botswana does not collapse because South Africa can pay doctors more than Botswana. By the way, you see, so it's the salaries. I can decide tomorrow that I want to go and work in Canada because there's more money there. You know, it's life. But should it be that way? So South Africa, instead of addressing their loss of doctors to richer countries and say, no, England, Canada, stop taking our doctors. You see, and also South Africa addressing the conditions that allow these people to live. You know, you have been to a GP. You have asked your GP, why are you in private? Why did you leave the public hospital? And he tells you, look, money and other reasons. It's frustrating working there. Everyone has their own reasons why they leave. So what South Africa did instead was to say, look, doctors want to leave, don't want to work in the rural areas. Doctors want to go work in England. Fine. We will go and get doctors from Cuba. The first group of doctors in South Africa from Cuba arrived in 1997. They were placed in the most rural of parts of South Africa. They don't have a problem with that. The money here is better than in Cuba. Life here, quality of life in South Africa is better than in Cuba. So Cuban doctors have always been coming to South Africa. We as South Africans do not have a problem with Cuban doctors. You see, we have never complained. We have never complained about the language barrier. People today are talking about language barrier. We know that Cuban doctors are primarily Spanish speakers. You know, we've never complained. They write English exams there to show that they have proficiency in communicating in English as the language of instruction in South Africa. But here comes the problem that we never bothered to address. They have English proficiency, but your grandmother speaks Zulu or Tsonga or Ndebele. So nurses have been translating for many years. I translate for my Cuban colleagues when they don't understand it. So we never had a problem working with Cuba. The government never had a problem. The government chose an easier solution. Instead of increasing our training capacity, we relied on Cuba to train doctors for us and also to send doctors to patch up our system. Cuban doctors are not employed in South Africa as additional staff. No, they are employed in South Africa as critical members of staff. That means if you tomorrow decided that all doctors from Cuba must leave, a few hospitals will collapse in Limpopo, Northwest, Eastern Cape, Mpumalanga. They will collapse. They will not have enough staff. Cuban doctors are not here as additionals. They are here because the government has a serious, crippling shortage. So, I hope that gives you a background between the complex relationship between South Africa and Cuba. Cuba provide doctors, South Africa pay. That's how it's been. Now, the second question that people have been asking about these doctors who arrived. Remember, you have never known when Cuban doctors come here. They've been coming here since 1997. You have never known and you have never bothered to care. Today we care because you heard of a price called 500 million rands. The government has been housing Cuban doctors since 1997. So that is not going to change today. That contributes to the price tag. The government has to pay Cuban doctors. They pay tax here. And they pay tax back home in Cuba, by the way. I looked at the number. I don't know if the 500 million price tag is the actual number. But what I did see there was that around 300 million is budgeted for salaries. Well, I ran the maths, that works to around 1.5 million rands per doctor per year. It's not the 2.5 million that everyone is talking about. That number is wrong. Let's say the 500 million price tag is right. Of that 500 million, 300 million will go to salaries. The other 200 million, flights, other things, food, accommodation. So I did the math. It works for the 187 doctors. The other, they said 214. I think the other people are diplomatic.